You know, we're feeling the effects of the pandemic, not just physically, but on our mental health. And so are our kids, too. Allison's back with us now. Doctors have been concerned about this effect that it's had on our headspace for months, Allison, but this new report looked at children specifically.
Yeah, the new CDC report shows emergency room visits for mental health concerns in children increased substantially this year. That report found beginning in April, the number of children's mental health related emergency department visits among all pediatric visits increased and stayed high through October. The director of psychology and neuropsychology at Johns Hopkins All Children's Hospital here in St. Pete says there's been a significant increase there compared to this time last year. So what do you need to look for? Dr. Jennifer Kansenstein says in younger children, changes in appetite, sleep, or more tantrums, wetting the bed, or nightmares. In older children, maybe they're not enjoying what they used to, or they stop showering, caring for themselves, or caring for their things like they used to, or they're sad and withdrawing from friends and family. When it comes to getting help, she says to start with modeling behavior for your children.
When we do have a time where we get upset or they see us having an emotion, labeling that emotion and talking to our kids about what we do to cope, because that's really how we can model for them the best ways to cope in these significant times of stress.
So where can you go for help? She says talk to your pediatrician or your primary care doctor. They'll have a screening measure to give you a better idea of what's happening with your child. You can also reach out to your insurance carrier for a mental health provider. And she also says mental health issues can have long-term effects and also physical effects, things like high blood pressure, obesity, and diabetes. So talk to your doctor if you notice changes in your child.